when you have a heart attack, a part of your heart muscle dies. What happens is a blood vessel that feeds oxygenated blood to the heart muscle gets blocked off by atherosclerosis, and the part of the heart muscle that needs to get the blood from that blocked vessel no longer gets that blood, and the muscle dies. The way in which we treat that is to open that vessel as quickly as possible, do an angioplasty, put a stent in, and in more severe cases, people have to have bypass surgery. But the problem, we're still left with the problem. The muscle is dead, and the more dead muscle, the worse the patient's going to be. They're going to develop congestive heart failure and have to be in the hospital and have a lot of other things done to them. So this is why stem cells are exciting, because we think we can fix that dead heart tissue, at least in part. We can reduce it by maybe 30 or 50% by stem cells and regrow new heart muscle. And the stem cells we've been using don't come from embryos. They come from patients themselves. They come from patients' bone marrow. And our most recent discovery that's very exciting is that the cells come from the heart tissue itself. So this goes back to what I said. We have reservoirs of stem cells left over in our adult organs. No matter how old we are, we have some of those cells in our hearts. And we have discovered at the Institute how to go in, take a small biopsy of the heart, grow up the stem cells, and give them back to patients. And the trials that I've done, which were referred to so kindly in my introduction, are trials that look at using bone marrow and using cardiac tissue to treat heart attack victims and try to repair the damage that they've had from a heart attack. The results we've had thus far are simply startling, very, very impressive. We've been able to reduce heart attack scar tissue by anywhere from 20 to 40% with a single treatment. And the patient's hearts get better in a process called reverse remodeling. After a heart attack, a patient's heart will blow up like a balloon. It'll go from a small football-shaped structure to a larger basketball or soccer ball-shaped structure. And it's that process of remodeling that is the problem, that causes the congestive heart failure. And what we've discovered is that the cell therapy restores that back towards normal. So here we are. It's 2012, 100 years, and we hope that somebody will be standing here at 100 years from now giving the same speech saying stem cells have prolonged the life of human beings by about 20 or 25 years. But not just the length of life, also the quality of life. We think that these changes and these treatments will not only improve the heart function, but will make people feel better.